These are the general sympathetic or adrenergic receptors that we're looking at. We see alpha-1 is mostly what we're dealing with on the alpha side, and then beta adrenergic, and we know that there's like 2 of those. So where are these things located? So here's the location of these different receptors. Alpha-1 is on the vascular wall, but did you know it's also on the heart? Usually we think about alpha-1 just being very peripheral, but it's also on the heart as well. We also have beta-1 on the heart, and then beta-2 on the blood vessels. That's an oversimplification. Why? Because there is always some crossover. So what do these things do? You probably knew alpha-1, vascular wall, vasoconstriction. What else would it be doing there, right? We know it's adrenergic, it's squeezing, right? But look at the heart as well. Increased duration of contraction without increased chronotropy. Increased duration of contraction. Doesn't that make sense with alpha-1? Because if we think about alpha-1, it's that afterload. So whatever the heart is pumping against, it's more difficult for the heart to pump against an artery that is constricted, right? But that raises pressure. When the artery is constricted, it increases that pressure. So when we have this constriction, you want to have the heart constricting or pumping, inotropic effect, that squeeze. You want to have it pumping, squeezing for a longer period of time to overcome that initial resistance of the arterial system. So it's interesting that alpha-1 does that. Vasoconstricts, but also increases the duration of that contraction so that we can get more flow moving forward. It's interesting, right? And then maybe we're a little bit more familiar with the beta stuff, right? Beta-1 is heart. So increased inotropy and chronotropy. You could include dromotropy in there as well, which is the speed of the electricity. Mostly concerned about the strength of the contraction and how many times in beats per minute that heart is working today. So we're going to focus on the inotropy and the chronotropy. Beta-2, blood vessels, vasodilation. Isn't that interesting? Alpha-1, just remember, peripheral squeeze and then increased duration of contraction. Beta-1, heart, pumping more strongly and then also pumping more often. And then beta-2, blood vessels, is going to give us some vasodilation if we need it. Specifically maybe in like the larger muscle groups and things like that.